Hi everybody, I'm Mike Simmons. Please just call me Mike. I serve as your state senator for the 7th District, which covers the Uptown, where we are now, Buena Park, Sheridan Park. For those of us that live in Sheridan Park, I used to live in Sheridan Park, and I always like when people shouted out Sheridan Park. Wrigleyville, Ravenswood, Andersonville, Arcadia Terrace, Budlong Woods, North Center, West Ridge, Rogers Park, and Edgewater. So if you're in any of those neighborhoods, I am your state senator. If you just happen to hear about this town hall and decided to crash, I'm game for that. We really need everybody to be engaged and in dialogue with what's going on in our state. So I'm glad to see you here. I also just wanted to ask that you give us a little patience. We had a little bit of tech difficulties with the sound, but I think we managed to rectify all that. So a couple of housekeeping things before we start. First, I just want to say, again, thank you to all of you for being here tonight, but I also want to thank my staff. They're going to kill me for doing this, but I'm so lucky because they work so damn hard to pull off town halls like this. So Heather Sanger, our chief of staff, did a phenomenal job putting this together. Connor Bishop, our manager of operations, there's no tech problem we can't fix. And Gabby Tarojos, our mighty outreach coordinator, who is all over the room right here. Fellow Ethiopian American. And then we have Doyon, who is actually an Amherst College student, is a fellow in my office this summer. She actually helped us to prepare for this town hall as well. Doyon is here somewhere. Shout out to Doyon. So just again, quick housekeeping. So I personally always love to be in Uptown because I've got long ties to this community. My partner and I lived here for over 15 years. I've been priced out of apartments in Uptown for the last 10 years. I know what it's like to struggle economically here. My mother, before she opened her own salon in Rogers Park, worked in a beauty salon on Wilson in the late 90s and early 2000s, where she experienced wage theft and an employment situation that was just really all too common in a lot of our communities. And so a lot of what I have tried to do as state senator is to really center those experiences and people in places like Uptown, Edgewater, and Rogers Park who really are struggling. And then those of our neighbors who really care about having an equal and humane society. So those are a lot of the values that drive this work. And I think you'll hear some of that come across in the updates that we have for you tonight. So what I would like to do for tonight's town hall is to talk with the agenda, is to go a little bit through Trump's, the federal budget bill, H.R. 1, otherwise known as the Big Beautiful Bill. Pardon my French, but I've been known to call it the Big Stupid Ass Bill because there is not an iota of good policy in this bill. We have combed through it. We looked through, my staff and I read through Project 2025 last fall because we saw a lot of this crap coming. And we've introduced a lot of proactive legislation at the state level to try to ward off some of the damage that's coming from the federal government. So I'm going to walk through the provision of that bill as it relates to healthcare, as it relates to energy assistance and food assistance, and talk about what the local impacts will be so that we're clear-eyed and prepared. And then for the final part of the town hall, I want to give you a quick overview of some legislation that my staff and I were able to get passed this spring in the Illinois General Assembly that was signed by the governor last week. So we got, I think it's 6 new bills that are now law of the land that have everything to do from housing equity to making our streets safer for pedestrians and cyclists. I, your state senator, am an avid cyclist. You probably have seen me out biking on our corridors. It is me, it is not a lookalike. And I'm also, as many of you know, a diehard public transit enthusiast. I've used public transit my whole life. I will live and die by CTA Metro Pace and every bus and train system in the world because I think they really are how we're going to save our planet. So let me just dive right into the meat and potatoes of the program. So Trump's federal budget bill, as you know, was signed into law ironically and diabolically on the 4th of July. This bill is a devastating policy decision for average people in our state and certainly people in our neighborhoods, and really wanted you to understand what's happening in this legislation because I think more than any other bill that has come out of the federal government will have an impact on our neighborhoods. Specifically, it guts the social safety net and drives up costs for healthcare, food, and utilities. While this bill includes a few tax promises for working and middle-class families, those are set to expire in a few years. We'll talk about those too so that if any of you are in a position to take advantage of those, you can do so. But the funding cuts to social services are permanent, and so I'm going to be talking about progressive revenue ideas that I and members of the Senate Progressive Caucus have been pushing in Springfield for precisely a moment like this when we no longer have a choice. My goal today is for you to walk away from this town hall with a concrete sense of not only what's coming out of this federal budget bill, but what I as your state senator can do in response And as always, I'm very open to any suggestions, ideas that come from constituents on these matters. By the way, if anyone needs to use the restroom, it's just right this way. So let's start with healthcare. For Medicaid recipients, here are the key changes. So the first, and I get a little upset sometimes talking through these because my staff and I have been fighting these proposals for several months now. There's a new work requirement for those in the Medicaid recipients. So starting in January 2027, individuals ages 19 to 64 will have to report 20 hours of work, school, or community engagement activities per week to qualify for Medicaid. That is a first. Recipients are exempt if they are a parent of kids 13 or younger, if they are medically frail, or getting treatment for a substance use disorder. But they will still need to prove the status to keep their health care. Either way, consider closely following the Illinois Department of Health Care and Family Services for updates on how those work requirements will be implemented. I also will make a commitment to you that my office will keep you updated through newsletters, social media, and just in person on what these work requirement implementation policies will look like. I want to take a minute to also just refresh that I introduced legislation this spring that would prohibit work requirements from being imposed on Medicaid recipients in our state. We have not been able to get, thank you. We have not been able to get a hearing on that legislation, and that is obviously very frustrating. The second proposal in the healthcare section of the federal budget bill will impose more frequent redetermination. So that, to say this in plain English, one of the things that drives me crazy about government is that government often designs programs to benefit the bureaucrats that implement them and not the people they serve. I know that because I grew up in a household where our family relied on SNAP, we relied on LIHEAP for energy assistance, and I remember how hard it was for my mother and I to try to navigate with people on the phone who didn't care about us and just wanted to get us out of the room. So what the Trump administration has done is they've gone on steroids with this. And starting in January 2027, Medicaid recipients will have to renew their Medicaid eligibility twice a year rather than once. Recipients should closely, what I would like to ask any Medicaid recipients here, or if you have loved ones that are on Medicaid, is to closely track those renewal deadlines and make sure you complete the paperwork on time so that you don't show up to a hospital or in a clinic and find out all of a sudden you don't have Medicaid. If anyone here is having difficulty with the renewal process, please reach out to me or my office for assistance. We think about this issue around the clock because, again, I as a senator know what it's like to watch people just fall through the churn on Medicaid and all of these other public assistance programs, so we don't want that happening to our neighbors if we can avoid it. The third provision here is higher co-pays. So starting in October of 2028, Medicaid recipients will be charged up to $35 for certain services. This will not, however, apply to primary care, mental health care, or substance use disorder services, as well as services that are provided by federally qualified health centers, FQACs, which we have a pretty good presence of in the 7th District, and rural health clinics. Cost sharing will be capped at 5% of a family's household income, which obviously seems like that's a humane part of the proposal, but in the grand scheme of things, $35 in co-pays can be a lot for somebody who's making $8,000 a year. And there are some of our neighbors here in Uptown where we have some of the highest poverty rates by census tract of any neighborhood on the north side of Chicago. This will affect a lot of our neighbors who ultimately will disengage from healthcare and will become sicker. And unfortunately, if we don't have the services for them in place, they will die. There's also an attack on reproductive health care effective immediately. The big stupid ass bill, so let's call it what it is, prohibits Planned Parenthood from receiving Medicaid funding. And there are, I will say, ongoing lawsuits over this provision, but for right now, as of August of 2025, Planned Parenthood of Illinois continues to provide care for Medicaid recipients, including OBGYN appointments, STI and cancer screening, and contraceptives. If anyone here is trying to access reproductive health care and is running into any issues or any systemic barriers, call my office. We will help fight through the system to make sure you get what you need. For those who are covered, just to transition, to talk about the Affordable Care Act for a second. How many of you here have, if you're comfortable sharing, have had health care through the ACA Affordable Care Act via bond exchanges? Okay, so we have a lot of entrepreneurs in our neighborhood that get their health care through the exchanges that wouldn't have an option any other kind of way. So for those that get their care through the ACA marketplace, also known as Obamacare, here are some key changes. So under the Good Covered Illinois program, starting in November of 2025, people in our state will transition from healthcare.gov to Get Covered Illinois, and that'll be a new state-run website. The website will launch on October 1st ahead of the open enrollment period. So those of you that are on ACA probably know that every December 1st or so you get a bunch of emails about how the open enrollment period is open for the exchanges. So just look out for that this year, but know that there's a new website. I want to really underscore that the ACA marketplace itself will stay the same. This state is simply launching a new website with a live customer service function to make sure that the people in our state have access to information and assistance they need during the enrollment process instead of having to rely on the federal government. So this is a proactive, systemic thing that we are trying to do in Illinois so that people are not falling to the churn and dealing with federal agencies that continue to lay off federal workers, that continue to not return phone calls, even from elected officials that have called them in recent months. Never seen anything like it, and so we're not trying to make people feel or anxious. We just want people to be prepared and understand that we are here to serve and work with you to get what you need from these services. The next part of the ACA change is that we can expect that there'll be higher premiums. Starting in January of 2026, the ACA plan enrollees will have to pay higher premiums because the federal budget bill removes tax credits to healthcare providers that help keep costs down for people who pay for ACA marketplace plans. So with those tax credits gone, what we know will happen is that premiums for enrollees will likely rise. We do have access to an online calculator for those that may want to get access to that to kind of budget ahead for what they may expect. But we think it's important for people to know this and just not be surprised at the last minute when these policies take effect. Another thing that we saw when we combed through the federal budget bill is an end of the auto renewal. So starting in January of 2028, the ACA marketplace plans will stop auto renewing, meaning that folks will have to renew coverage every year. And if anyone faces any difficulty in that renewal process, once again, reach out to me or my office for assistance. We will sit down and we will come meet you in your home if we have to, or your apartment, to help you with this. So to fight back against the threats these changes are posing in our district, I want to talk about a few solutions that I think can make these services more accessible for those that need them most. And in spite of the burden that the federal government is trying to create, there are two things I want to talk about on a lighter note, because I know a lot of that probably was upsetting here. I'm very proud that in Uptown, we are actually going to be having a new physical Department of Human Services office open. It'll be a satellite office. The community has fought for years to make this happen. Yeah. So yeah, I mentioned earlier how many of our neighbors in Uptown, my dad was an asylum seeker from Ethiopia who came here in the early 1980s with $5 and a guitar and had no family here. That's the case today. There are immigrants and refugees and people from all over the world that continue to come to Uptown. And what I'm happy about is that when these federal policies are taking impact from the federal budget bill, they will be able to go to a satellite office right here in our neighborhood, and it'll be a Sheridan and Lawrence in the ICA building, where they'll be able to access state services from the Department of Human Services. And the Department of Human Services is the state agency that most closely touches these issues. So that's a huge win for our neighborhood. It's a huge win for the 7th Senate District. And we'll be keeping you posted on the exact date when the DHS satellite office will open. But really want to give a shout out to our neighbors and our community organizers who have been pushing on this since even before I came to office. And thank my staff, because we have been working around the clock literally with Leslie and the folks at ICA to bring this to fruition. So that's a happier update. The second update that I wanted to mention was that we are continuing to fight to pass Senate Bill 1969, which is legislation that would put social service workers in our senior affordable housing buildings. Why are we doing that? Well, Uptown has a lot of seniors. We have buildings from Ruth Schreiman and Buena Park to Ella Flagg apartments right here on Wilson and Leland. And just, seniors are the heart and parcel of our neighborhoods. And so we're fighting to make sure that they can get access to people that can help them with what they need, where they live, so that they don't have to sit at home and suffer as all these federal policies are coming live that are going to probably make life harder for them. My office understands that seniors need people to help them access Medicare, Medicaid, SNAP, LIHEAP, and other services. And so with that legislation, I would offer that instead of forcing seniors to search for these programs and auto-renewing through all these bureaucratic things that working people don't have time to do. They don't have the time to navigate these programs. People here don't have time to fight with bureaucrats. People here don't have time to be on the phone for 50 minutes with somebody from a federal agency who then just drops the call on them. I've been through that, and I don't want anybody I represent to have to deal with that. So we'll continue to fight for that legislation, and we'll keep you updated on how things unfold there. So let's take a breath. That was a lot. The next section of our updates on the federal budget bill will cover food assistance, but I want to just give folks a chance to just digest that, and we'll do some Q&A at the end of the town hall. So food assistance, everybody has to eat. Everybody needs access to nutrition, and I refuse to accept that in America and Chicago, and certainly not in Uptown, is somebody being able to access fresh fruits and vegetables a privilege or something that you only can get if it's a luxury or that you wouldn't be entitled to. I think that's a basic human right. As a son of an asylum seeker, I think when my grandmother, who didn't speak English, thought about her son coming to this country as a refugee, she thought that her descendants would be able to eat fresh fruits and vegetables. It's such a basic right that humanity ought to have. And I'm pretty outraged that the federal government and the Trump administration took a pretty huge axe to the SNAP program, and so let's just talk a little bit about what some of that will look like. So there's another work requirement that's being proposed starting in October of 2025. The SNAP work requirements will extend to older adults who are between 55 and 64, parents with children 14 and above, veterans, people experiencing who are unhoused, and former foster youth. These are groups who now will have to report 20 hours of work, school, or other community engagement activities per week to qualify for SNAP. So that's somebody in Congress and the Trump administration that thinks that you don't deserve to eat unless you can prove to a bureaucrat that you volunteered for somebody somewhere, or that you engaged with the community through a program, or that you found a job. And I would say a lot of our neighbors in Uptown want to work and cannot find work. That's why we've been putting on job fairs for folks and translating job opportunities into multiple languages, because people want to work, but they can't find jobs. And so that's, for me, very outrageous. It makes me outraged. The next change that I want to talk about is the changes in eligibility for SNAP. So this is also equally heartbreaking and very upsetting, is that refugees, asylees, and people that have been granted withholding of removal, all of whom are legal immigrants, by the way, are no longer eligible for SNAP benefits. So the state of Illinois will not implement this provision until we have further guidance from the federal government on what any of that means. You know, previously, we, like I said, we've never had policy proposed like this, and so it can be hard even for our state departments to know how to implement it, because they're not giving us any guidance on exactly how this is supposed to be put in place. We did comb pretty carefully through the bill, though, and we know that those who come from Haiti, Cuba, the Marshall Islands, the Micronesian Islands, or Palau, certain groups from those countries will not fall into those categories and will still be able to access SNAP. But this is still a lot of our immigrant and refugee communities that, like my dad, are coming here as asylum seekers that are going to be depending on our food pantries, and that's going to put a lot of pressure on our local food pantries, such as Nourishing Hope in Lakeview, Care for Real in Uptown, Friendship Center in Lincoln Square, that are already overstressed because people have been so hard hit in the last few years after the pandemic, and people are depending on food pantries who never thought they would be. And I will say to you all today, as your state senator, that I don't want anybody to ever feel ashamed that they can't access fruits and vegetables. If you ever are, or someone you love is dealing with that, or your neighbor, let us know. We will come to them and we will make sure that they get to a food pantry and that they're able to have food in their refrigerators. We also have great mutual aid organizations in our community that are doing this work. Too many to name, and I want to thank them all for doing this, because it's a key part of making sure that our neighbors don't starve. The last point on our food assistance that I want to talk through, and I apologize, these are very upsetting policy proposals, and they're upsetting to go through, but I'm going to try to get through this. SNAP cost burdens are shifted from the federal government to the states. So another thing that the federal budget bill does is, starting on October 1st of 2027, states could be forced to pay up to 15% of SNAP benefits based on administrative error rates. So to give you an example of what that means, in 2024, Illinois had about a 12% error rate in administration of SNAP. If that stays the same, that error rate stays the same, Illinois would have to pay $660 million back to the federal government in the next budget year. Obviously, that's money that the state doesn't have right now. I just today called on my colleagues to go back to the General Assembly and have a special session to fully fund public transit and to fund our public transit. And we know to really fund our public transit in the way that our neighbors need would cost about $1.5 billion. So these numbers really do give me sticker shock in terms of what the fiscal climate is going to look like in Illinois in the next 2 years and what we need to do to get ahead of it. So finally, in response to these unprecedented budget challenges, on that note, I want to just take a minute to plug a couple of progressive revenue policies that I and my colleagues in the Senate Progressive Caucus and House Progressive Caucus have been advocating for. So, you know, it's interesting because people always say that people should figure out how they're going to pay for programs. And we've been hearing this austerity debate for about 40 years now, since the Reagan administration, that, you know, certain people deserve to be poor, certain people don't deserve health care. I roundly reject all of that rhetoric, and I think that now is the time for progressives like myself to come in with the receipts. So I'm going to tell you that this spring in the General Assembly and the State Senate, I proposed several revenue ideas. The first, in partnership with the Illinois Revenue Alliance, would be a tax on digital advertising, which would bring the state of Illinois $725 million. A corporate tax on worldwide combined reporting would bring Illinois $1.2 billion. A tax on corporate offshore sheltered income, tax shelters, $200 million. Closing the carried interest loophole, $1.5 billion for the state of Illinois. Putting a tax on billionaires, $840 million for the state. An excess tax on capital gains would bring us $1.7 billion. Raising the corporate income tax would bring us $830 million. Closing corporate tax loopholes, which I strongly feel we need to do, would bring us $175 million. And reforming the estate tax would bring the state of Illinois $150 million. This is the revenue that we need to fully fund public transit and to shore up our healthcare system and to make sure that people have energy assistance and all the things that we're not going to be able to have a debate with our Republican and moderate colleagues in the General Assembly on whether or not we're going to do these things. We're now forced to reckon with these issues. And so as your state senator, I commit to you that I'm prepared to continue to fight that good fight. So let's talk finally about energy and environment. So in the 7th district, in the neighborhoods I mentioned earlier, you know, I'm thankful that we have a lot of constituents that are really engaged with the issue of climate justice. It really is true that we don't have any more time on this issue. I'm sure some of you that have lived in Chicago for more than 10 years have noticed that during the summer we have wildfire smokes that are coming here from 15 hours away, places in Canada that would literally be as far away from where we are now as New Orleans is, where you wake up and all of a sudden the air quality is the worst air quality in the world. We're reading news every day about wildfires in places like Colorado. Some of the most beautiful and pristine nature spaces left on the planet are under siege right now. All of that is to say that the Trump administration is also taking the axe to collective bargaining rights of EPA workers, 1,000 of which in Illinois are paid every day to protect our Great Lakes. The Great Lakes represents 20% of the fresh water that we have on the planet of Illinois. It is such a gift that just literally a mile east of here, you could be standing in Lake Michigan, and it is a clean lake that you can actually swim in, that you can recreate in, that we can drink our water from, and I want that to be what the next generation has, because I grew up in Chicago with that, and that should not be a luxury or it should be an entitlement for all that live here. So let's start with electricity costs. From our analysis of the federal budget bill, we know that energy costs will increase for nearly everyone in Illinois, every household. So starting in 2026, household electricity costs in Illinois will increase about $180 per year on average due to the termination of federal clean energy investments. Gasoline costs will increase in the next few years. The average Illinois household will be spending about $120 more on gasoline in 2030 and $280 more in 2035. And this is because the federal government is rolling back the vehicle emission regulations and electric vehicle tax credits, driving up demand for gasoline. That is obviously not the direction we want to be going if we want to stop having the worst air quality in the world on random days in June and July, and having a Great Lakes that now is not going to have federal workers that can pull out the plastics and the forever chemicals and the PFAS that are starting to be a part of our water sources. This is really a crisis, and it really, as I said earlier, it's upsetting to walk through this, but I think it's really important that we have transparency on what the federal government has handed us here. I want to also say, on the lighter note, for those that are interested in purchasing electric vehicles, including plug-in hybrids, the end of that tax credit is coming. So after September 30th of 2025, the federal EV tax credit will expire. Currently, people can claim up to $4,000 for used electric vehicles and up to $7,500 for new EVs. So act fast if anyone is considering purchasing an electric vehicle, because you obviously can do it more affordably now than you might be in the next year or two. For homeowners who are interested in energy improvements, there's an end of the tax credit starting January 1st of next year, where the federal tax credit for homeowners to weatherize and improve energy efficiency for their homes will expire. Currently, people can claim up to $3,200 for projects such as window insulation and heating, ventilation, and AC upgrades. So act quickly if you want to take advantage of that credit. It's been really hot in the summer. I think we all can agree that we had a little bit of a drought the last 6 weeks. And I'm nervous that that is going to continue to be how our summers look here. So I encourage you to weatherize your places where you live. If you're renting, talk to your landlords about doing this. And once again, connect them to my office if they need help navigating these programs. So overall, I want to say that the federal budget bill drives up the cost of living and makes it more difficult to enroll in state programs such as Medicaid and STAP. So make sure you keep an eye out for notifications from state agencies about benefit status and newly created work requirements. Take advantage of federal tax credits while they're available. If you have any questions or concerns related to these programs, please reach out to my office. My team and I can help you navigate the bureaucracy and make sure to serve as an advocate for you. Follow my newsletter, senatormikesimmons.com. If you're not currently getting my newsletter, we send a newsletter out about once a week, and we try to give people the updates that they need. And we also like to make sure to just talk about the things that are happening in the community that folks here would want to be a part of. So that is the conclusion of the formal presentation. You all have a copy of this. When you walked in, you should have been able to pick up a copy. So this was again a collective effort of myself and my team. We started looking at Project 2025 last fall when they put it out. We anticipated a lot of these changes. We introduced a lot of legislation to try to kind of block and tackle some of these changes. I am proud to say that one of our bills actually got signed during the lame duck, puts Illinois on a path to removing forever chemicals from our water supplies. I don't know why that was a big fight in the General Assembly, but it was, and we got it done. It was signed into law, so that's a brighter note in all of this. And then before we go to questions and answers, for those of you that were not able to make last month's town hall, I just wanted to take a minute to give you a very quick update on legislation we passed in the spring and a few state level budget highlights, not federal. So we were able to, just last year, Governor Pritzker signed the bill that I offered I always like to say in our office that in the last 4.5 years, I have been able to pass 50 bills out of the Illinois Senate that have become law. I'm proud of that. That comes from our district. I think we need vigorous, energetic, passionate people in these offices and not people that are just going to just watch things be handed down. But what I want to point out that this is not about me. Of those 50 bills, about half of them came from constituents. People who came to our office who were in crisis. Somebody that had been kicked off of a program. People come into my office every week who are in the throes of the housing crisis in our state. It is a real issue that we're having right now that not enough, I'm just going to say it, there has been no political courage on the issue of housing. We don't have a housing committee in the state Senate. I have asked repeatedly that we create a housing committee, and I will continue to be a thorn in the behind of those that are in charge so that we can make that a reality, because we need people on the ground to know what committees to go to advocate for some of the policy changes that we know is the right thing to do. So Senate Bill 1173 is now law. This will take away the requirement that people who are unhoused, it basically will let them get a free state ID by filing an application, prohibiting notary fees for the application, ensuring that unhoused people can actually access a state ID. I know this sounds like super wonky and in the weeds, but it's one of these types of things in government that can keep people living under viaducts who want to be housed and who want to work, right? It shouldn't come down to the fact that somebody can afford a few bucks to a notary. So glad that we passed that law, and I believe that came from a constituent also. It was not my idea. The second bill that I'm proud of is that Senate Bill 2285 was signed into law by Governor Pritzker last week. This is a very timely town hall. We didn't orchestrate this. We just got a notification on Friday that they signed a lot of our bills. How many of you here are cyclists? That's pretty much everybody. If you live in Uptown, you've probably been on a bike. So this bill basically redefines bicycles in the Illinois Vehicle Code to include bikes with more than 2 wheels, such as cargo bikes and trikes, to ensure that they are street legal. That sounds really wonky in the weeds, I know, but it's really important when we talk about complete streets planning. So both in Illinois and neighborhoods, not like Uptown, where some parts of Chicago, there are aldermen that still don't get it, that people want to be on their bikes, and so those are neighborhoods that are still unsafe for cyclists. And some of our suburbs, where there are people in charge in those places that want to have safer streets for cyclists, but don't have a way to define them in the code. So we're fixing that through this bill. And that follows a number of other bills we've been able to pass in the last couple of years. About 7 or 8 bills we've been able to pass that really move the needle on making our streets safer for cyclists and pedestrians. I'm really proud of that. House Bill 2391 allows treated municipal water to be reused for authorized irrigation and industrial uses, allowing for more sustainable uses of water. I'm a huge water advocate, and one of the other things I've really worked on is trying to get lead out of our waters, getting lead pipes replaced, and this is a key part of that work. House Bill 2589 clarifies that patients who have prescriptions for injectable medications are allowed to purchase clean needles from a pharmacist, expanding patient access to a necessary medical tool. This is a part of the health equity work that we must continue to do if people are going to be able to access health care, particularly populations like myself who have historically been very poor served as a Black and LGBTQ person. And those were some of the main highlights. A couple of other bills that are up for further consideration. There's the big fiscal cliff with transit legislation. House Bill 3438 did pass the Senate on May 31st. This is legislation that would bring revenue to our transit system so that we can move towards having bus rapid transit. I specifically advocated for Western Avenue in Lawrence to be put in the first queue of routes that would have modernized bus rapid transit services so that people can get from here to Jefferson Park in 20 minutes. I think that we deserve that. I think there are a lot of people that work in our communities that are crisscrossing east and west and don't have a quick way to do that. And so we got to get that legislation passed. We got to make our transit systems much more reliable and dependable than they have been. And so that bill is of utmost importance that we really need the General Assembly. As I said today, I put out a letter calling on all of my colleagues to go back for a special session to deal with this issue, because I don't want us waiting until later in the year where our transit workers are going to start to be anxious that they're going to get pink slip letters, and that's going to affect our dependability. It just creates more and more dysfunction, and I think we in the General Assembly can do way better, light years better, in fact, on the issue of public transit. And then I know it's a lot to get through, so I apologize. I know I'm talking a lot, but I just want you to know what we're trying to get done here. So just for those that are not familiar, the transit legislation I'm referring to established the universal fare, synchronized scheduling between CTA, Metro, and Pace. So for people that work in Uptown that maybe have a job as far out as Carroll Stream, if you take the Lawrence bus to Jefferson Park and you're trying to get the UP and NW going west, it's better coordinated so you don't get there and you're not waiting an hour, and vice versa when you're trying to get back home to your kids. Another part of that bill would create transit ambassadors. This was something I really advocated for because I know that we need safety in our transit systems, but I do not believe, and several of our neighbors do not believe, that police should be the ones that have to take care of mental health needs in our communities. In fact, law enforcement even feels like that is way too much that we put on them. So the transit ambassadors act as a professionalized, customer service-oriented corps of civilians that are going to be on our trains and buses and help people navigate using the trains and buses and getting to where they need to be and de-escalating conflict. So I was proud to personally advocate through several, I think we had six committee hearings on this, and we were able to get into the final draft that passed the Senate. Another one of my bills, the People Over Parking Act, which a lot of our organizers in the district working with me on that really care about housing. It makes it easier for new housing construction to come online. It does not require arcane, outdated parking requirements. Was a part of the transit package that we passed out of the Senate on May 31st, and then it's yet to be acted on in Illinois House of Representatives. So proud of that legislation. I think we need to get this done, whether it's the bill that passed out of the Senate or a whole new bill that comes together from scratch. What I will tell you is that the research has been done on this issue. If anyone is telling you that we need to continue studying the issue, we've been at this for 2.5 years. We had over a dozen committees. I'm on the Senate Transportation Committee. We had hearings in every single one of the 5 Collar counties on the issue, and we brought in all of our stakeholders, and we even emailed out each of those hearings to our constituents. So we're out of time on this issue, and we just need the political courage to actually get it done. That bill also included revenue for our transit system so that we can actually have more frequent and reliable transit services. And I think specifically what CTA was talking about when we passed the bill is that the buses and trains will be running every 6 to 8 minutes for the amount of revenue that we were able to fight for in that bill, a lot of which came out of the progressive revenue ideas that I mentioned earlier. So we've done the work. We've done the work. We have the buy-in from the stakeholders such as Better Street Chicago, Commuters Taking Action, Active Transportation Alliance, and just like rank and file people that ride our public buses and trains who are following this issue, it's time to go back to Springfield and it's time to get this done. Lastly, and I will take questions and wrap up. House Bill 3564. This is really important. How many of you here are, if you're comfortable telling me, are renting now or have ever rented? Pretty much everyone in the room. So this legislation deals with an issue that has surfaced in recent years where you get ready to move into an apartment, and all of a sudden they come at you with all these fees. So there's an $800 moving fee. There's a $250 fee if you call your landlord after hours and tell them about a safety issue like the boiler's out. There's a non-refundable fee on X, Y, or Z that is in legalese and you don't even understand it. And they're all a bunch of junk fees that continue to be imposed long after the renter's lease has been finalized. I think that is outrageous and unacceptable. It creates a barrier to housing. It makes people afraid to call their landlords. If your boiler is out, I don't want you to feel like you're going to be charged a fee to call your landlord to say, hey, if you don't fix this, this place may burn down. It doesn't even make sense. So I'm proud to work on this legislation, House Bill 3564. We got it all the way to the point of being able to get a vote at the end of session. We were asked to wait to the veto session to move this bill forward, but I do have the votes. I did the roll call, and we have senators that will vote for this legislation. And we have a fierce champion in the House, Representative Nabila Syed, who is carrying this bill in the House. So, and we sat down with all of the housing advocates. We even sat down with the realtors to let them have their say. But I feel like the bill that we are trying to move forward is a strong pro-renter bill. And I will be, every other word out of my mouth during the veto session will be, we need to pass House Bill 3564. And if we haven't passed the transit bill, that will be the other word out of my mouth. So, you know, I think that is a pretty good overview of the legislation. I'm happy to get more into the detail in the weeds, but I don't want to keep you here and listen to me talk for 2 hours. So why don't we go to Q&A? And thank you so much for your attention. Thank you for being here tonight. Make sure too, when you get the legislative rundown on the front side is a recap of the state budget. I was going to go through this, but I think that might be too much detail. So just, if you've got questions on that, I will be here afterwards, so just feel free to come up and ask me about what you see on the budget side. So, okay, questions?
Also, let's do this just really quickly, no popping. So, a bunch of folks submitted questions online with your registration. Thanks so much for doing that. And then what we'll do is, how we've done it in previous town halls, we'll do an in-person question, and then I'll just popcorn back to the questions that were submitted online so everybody has a chance to hear his answer. User, person with the cap on, had your hand raised,
Yep.
and then we'll go to this.
We'll make sure everybody gets a chance to ask a
we will
question. Yeah,
make sure.
I'm not running out of here. Go ahead.
So I'm originally from Seattle, just moved here recently, and one way that,
Give me a mic.
so I recently moved here from Seattle like a month ago, and one way that Washington State does with their tax and how we get past a lot of issues there is the B&O tax. What that is essentially anything that's imported from other states into Washington State, they tax that company. And it's a tax that can't be passed on to the consumer. Is that something you guys could think of?
So really good question. Welcome to Chicago. Yes, I think that's definitely a proposal that we can consider. I have not seen a proposal like that in the General Assembly. But this is, again, the kind of thing that, like, my team and I will actually sit down and research and see if it's something that we can move forward with. So thank you for raising it. And we'll definitely look into it and like to be in touch with you about where we want to go with it. I can pick people, or do you want to, I think you have a system.
I'll flow to a question.
Okay.
Yeah, okay, so, a little more hopeful question.
What gives you hope in times like this?
Okay. So one of the things we like to do with these town halls is we ask questions live, and then we have people that could make it here that submitted questions. So we'll go back and forth on those. What gives me hope is the fact that people in our neighborhoods have not given up. You know, when I talked earlier about people in uptown who are very low income, or just people who have means, but just they really give a damn about what happens to people in their neighborhoods, right? They don't just stand there and watch somebody go unhoused, or somebody all of a sudden not be able to rely on the food pantry. I've been saying since I took the oath of office in 2021 that if my constituents and my neighbors are not giving up hope, then I damn sure am not. I've been given a position, I've been given a position of power and access in the state capitol, and so what gives me hope is that I can go to Springfield and have the committee behind me to push aggressively for the type of changes that we need to better serve our community. So what gives me hope is the people. That's the short answer. Okay, live question. Yes.
Yeah.
Can you talk loudly?
Yeah, I'll talk loud.
Okay.
Can everybody hear me?
Yeah.
Great. There's an article in the Sun-Times last week. Senator Buckner was indicating that the Senate has the votes to pass the transit bill in the veto session, and they want to move forward with that. But then today, you're calling again for special session. What's the disconnect here? Why does Buckner think, it's just gonna go veto session, and then it's just gonna get done there, and they have all votes, and
Yeah.
you guys are on different pages here.
Yeah.
The Democrats are supposed to be like one caucus
Right.
united in front on this issue, right?
Right. Big party, Big Ten. So it's a really good question, and it's an opportunity for me to sort of one of the things I like to do is to demystify state government, and so it's a really good question. The House and the Senate really are different bodies, and it took me 2 years to really figure it out, like at a brass tacks level. So the Senate passed this bill in May. The House did take up the legislation, but they've been working on this issue too. So I suspect what Representative Buckner is talking about is that he sees a path to passing a piece of legislation in the veto session, which is in October. Where I think I'm in a different place than a lot of my colleagues is I think we need to be doing that right now. If the path is there, then let's get on the path right now and not wait till October. That's where my position is. I don't like when I see, I ride public transit all the time. I don't like when constituents ask me like, why is this not happening? Like, why is there just all of a sudden been radio silence on public transit? It's embarrassing. I don't know what to say to them, and so that's why I'm calling for us to go back down now and deal with the issue. And so I think either way, this is going to happen. It's just I don't think we should be waiting to the end of the year. And I would like to know what final bill we're going to be taking up, because I think it needs to be strong on reform. I think it needs to be strong on funding, and it needs to be something that's going to take effect relatively soon. And so those are kind of my North Stars, and I'm confident we'll get there. But I think my sense of urgency on this is red hot right now as a public transit user. Yeah.
Okay. All right, next question. This is a federal ICE-related question.
Okay.
From a neighbor who lives on North Sheridan. What are you doing to keep ICE from kidnapping our neighbors? How will you educate your constituents about the dangers of the current federal government, in their quotes? Are you willing to admit we are currently living under a dictatorship that is quickly chipping away at our freedoms? And how can you help us get those freedoms back?
Yeah. It's a great, what an eloquent question. You could write a book in response to that, right? So, I don't support ICE. Immigration raids break my heart. It was one of the most traumatic things our community has gone through this year. Was in January when all of a sudden we saw that there were ICE agents at Rogers Park, near Lunt and Greenleaf, in Damon, walking down the streets, and I have still not gotten over that, and I'm not even the person that they're after. So, I would say that, first of all, ICE was created during a time of anxiety and fragility in the Bush administration. They launched the war in Iraq, they created ICE, and all of these other federal agencies that I think never should have been created and have long outlived their usefulness. So I think we don't need ICE. And I'm not afraid to say that as a public official. We definitely don't need ICE in this community. And I think what we've done is to be in frequent and deliberate communication with our constituents about how to protect themselves from some of the immigration raids, because a lot of our neighbors have loved ones. I have loved ones that can be targeted. I have family that are coming from Ethiopia now who are afraid to be here. And that's never been what it is meant to live in Uptown or Edgewater or Rogers Park as a refugee. That is a first time in history that's happening, or at least modern history. So we're pushing back aggressively on it. We're working closely with our mutual aid organizations to make sure that people know their rights, making sure that our immigrant and refugee serving organizations are fully funded by the state. I think we were able to get $54 million in the state budget this year to make sure that immigrant serving organizations have access to, are able to provide lawyers, able to provide family reunification, able to provide housing for those that are newer to our community. So that's the work we're doing. And yes, we are living in a country that is moving toward authoritarianism. I mean, it's very straightforward. I mean, literally, the Trump administration yesterday said that they're going to initiate a purge of the Smithsonian. They're going through exhibits about Black American history. My mother is Black American. My dad was from Ethiopia. I have direct ancestors who were enslaved in this country. And the Trump administration wants to erase all of that and talk about how it wasn't that bad. That's why I'm pissed today. That's why I've been physically shaken since I started this town hall, because there is so much coming at us right now. And I would say that it is absolutely the signature of an authoritarian regime in the making, and that's why we need our public officials to be fighting back right now on all of these issues that touch all of our lives. I hope they're happy with that. Yes, you're the best.
Hi, this is a super detailed question, but looking at that 11.56 error rate, is it worth trying to reduce that rate, or are there?
Yeah. Phenomenal question. So we talked about one of the draconian things the Trump administration is doing in the federal budget bill is making the state of Illinois pay for any administrative error on the SNAP program. I know, again, this sounds really in the weeds, but the most diabolical, evil things out of government offer like at the arcane long level. And yes, like we absolutely need our state agencies to step up their game right now. We don't have literally any margin of error right now on administrative oversight or delay or any of these issues that we have seen in some of our human service serving programs. We actually, our staff, our summer fellow, Elijah, is actually working on a bill that we want to bring forth, hopefully as soon as the veto session or January, that attempts to proactively deal with this issue. So we're tracking in the same place here, because we're going to have to do that if we don't want to be in a $600 million hole next year in the context of trying to fund transit, trying to figure out, like, I still think we need to be resuming healthcare for undocumented immigrants in our communities. Like, there are a lot of things that we need to be doing right now.
Okay, next question. This is about the EPA and a union contract. The EPA decided that they'll rip up the AFGE union contract on August 11th. How are you helping now to restore labor and worker rights in Chicago and America? And also, thank you for representing us.
Yeah. That's another great question. I love our district. People are so engaged and they ask really thoughtful questions, and that is one of the biggest honors of serving as your state senator, is how engaged people in this district are. It makes it easier for you to fight the good fight when you can point to thousands of people who are writing your office and saying this is what we need to do. So yes, some of you have read in the news that the Trump administration is union busting on our EPA workers. This represents two major policy failures. One, it's taking away the right to collectively bargain is an assault on worker rights. Two, it's an assault on our climate, because those same workers that work for EPA are working to protect our water. They're working to protect the Great Lakes. They're working to protect our land. They're working to improve our air quality. So if you just come in all of a sudden, don't let them do collective bargaining, well, the research shows us that when you take away those rights, people become demoralized. These are talented engineers and scientists that can find jobs other places. They don't have to be working in the public sector. So I think this is a policy failure on an even bigger level, because it's just two core areas that are very passionate for me: the climate and worker rights. So what I'm doing in my state senate capacity is I've been in touch with the leaders of the American Federation of Government Employees, and we're actually working on putting on a hearing at the state level in the Department of Public, I currently chair the Senate Public Health Committee, so I'm going to convene a hearing in the Senate Public Health Committee with some of the EPA workers that are affected by this, with some of the people that care about environmental justice, with the representatives from the American Federation of Government Employees 704, who represent those workers, to try to bring this issue to light for everybody so that people can respond accordingly. Whether it be policy proposals that we can bring forth at the state level, budget changes that we can make, or just putting pressure on the federal government to do what's right now by our workers and for our environment. So, it's a good question, because I really think that we can't afford right now to, just because we're a blue state and we're an island, just sit and watch all this happen. We have to really be proactive in terms of trying to mitigate the damage. And so yeah, we're gonna do that hearing in the coming weeks. David, you've been waiting a while.
That's okay, I'll always wait. First of all, thank you so much for standing with us at Weiss Hospital on the day that it closed its emergency room. I know how hard you're fighting for safety net in hospitals, but of course I look at this list and see $12 million for the 7 district hospitals, including Weiss.
Yeah.
That's a big problem. I know a couple of your colleagues in the House are already talking about a bailout for Resilience Healthcare, which is the private equity firm that currently runs Weiss and West Suburban hospitals. This is a major problem. Has that money yet been dispersed? What can we do to prevent it from being dispersed, if so? And can it instead be used to make sure that we get a public takeover by Cook County Health of these 2 hospitals and take it away from this private equity firm that is running these hospitals into the ground?
Yeah. Yes, So Weiss Hospital was designated as a safety net hospital in 2022, which allows Weiss Hospital to get access to more Medicaid, Medicare dollars and things that we need to serve our very low-income residents that live in the neighborhood, who otherwise would be medically underserved. You know, the situation that we've seen with Weiss Hospital is right. You've got private equity that's come in, obviously, and has targeted this location. I believe what they're doing is they're trying to get access to valuable real estate to do whatever they want to do with it. I don't know how to mince words on that. In 2021, and within the first 6 months of me being state senator, I actually stood with activists protesting the new, and I have nothing against anybody who lives in the new building now. They are our neighbors, they are renters, love them. The way that came to be though, I mean, they literally, the zoning process that was used to greenlight that building was corrupt. There was an agreement that was made to not move forward on that development and keep that lakefront land an open space or for medical use. And it was reversed in the middle of the night, and all of a sudden it was in the news that they were moving forward on it, and people would not return our calls. So that was the first shot fired. This is the second shot fire. So these problems with Weiss Hospital have been ongoing now for about a decade. And what we have now is we have, I think, a very inept CEO who does not care about our community, does not live in our community, and does not care what happens here next year or year after. And so you're right, what we need to do right now is we need to audit every dollar that has gone to this hospital from the federal government and the state government. We are in touch with the IDPH and with the Department of Health and Family Services of the state to see what money has gone to Weiss Hospital in the last 6 months. You are right that the General Assembly, we were able to get $12 million for our safety net hospitals in the 7th district, which is the right thing to do. Because in this district, we have three safety net hospitals. We have Swedish Covenant at Foster and Lincoln. We have Weiss Hospital, which has only been a safety net for 2 years, and then Thoric. If you didn't have those hospitals, this would be a medical desert. There would not be anywhere for people here to go. You have to go all the way to St. Francis Hospital in Evanston. I don't think that's, I think we can do better than that on the north side of Chicago. So we can't lose a safety net hospital in this community. I think we need, and I will say this on the record, I think that Prasad, the CEO of Weiss, needs to go. I myself have reached out to CMS, the federal CMS. Myself, Alderwoman Clay, Rep. Wynn, and others put a letter to CMS. Was it August 8th or earlier even? Yeah, it took them 2 weeks to get back to us. They did not take our calls. They literally treated us as elected officials like we were just people off the street. And so I called on Senator Durbin, Senator Duckworth, Congressman Schakowsky, Congressman Quigley to throw their weight around. Pick up the phone and call the CMS and say, hey, we need your help here. We cannot lose this safety net hospital. That's not an option. So the reason the CMS has come after Weiss is because there are about 8 or 9 violations that were found in the hospital. They were supposed to be placing HVAC systems in their hospital. Never was done. And the money is not the excuse because there were capital dollars that came from the state to make those improvements. They gave us a whole tour and said they were going to do all these things and didn't do it. They were supposed to be building a mental health unit on the 8th floor of the hospital. It hasn't happened. So the leadership there has to go. They are inept, and we need CMS to grant an extension to the hospital so that the local electeds, Alderwoman Clay, myself, Rep. Wynn, and others that are working on this, meeting every week at 8 in the morning on Wednesday to try to find out how we can have a path forward for them. And David, you're right. Alderwoman Clay has been in conversation with the Cook County Health and Hospital Systems to see if they can subsume Weiss Hospital. I don't have the latest on those conversations, but I know that that's something that we are trying to make happen. I've myself been in touch with Erie Family Health, which is one of our local federally qualified health centers, as well as Taylor Street 360 to try to see if there's room for a partnership or acquisition by a public serving health facility and not some private equity slumlord that is 3,000 miles away that doesn't care about our communities. That's what we need to do right now. And we're grounding it out day by day right now. Why don't we go to you while we're waiting? Yeah.
Thank you, Senator, for everything tonight. Keep up the fight on the housing committee. I would love to have a hearing Monday in housing. But we're sitting in a CPS school, and the governor, I think today, said they're not going to resolve the $750 million budget goal from a state perspective. I'm curious, where are you at this point? Is there any room for the state to kind of change its funding formula? Should it change funding formula? How are you seeing the CPS budget process?
Yeah. So the first thing is that in the last 2 budget cycles, I've really pushed hard to increase evidence-based funding for our schools, and all that is, EBF funding is I would say the easiest way to put it is in 2017, before I was in General Assembly, there's a new equitable funding formula that was put in place to put more money into our public schools. So every year, you know, we know that we need to probably, I forget the exact number of what's needed to really make our schools equitable, but every year we're putting 300 to 350 million additional dollars into our public schools. So that's step one, is that we have light years to go in terms of actually making our schools funded in an equitable way. That 350 million, I personally have asked that we move it up to like $700 or $800 million a year. And again, we have the revenue ideas to back that, right? Like, I'm a proud progressive. We sat down with the progressive, the budget office, proactively sat down with them. We researched, we have 25 bills that we floated to bring in progressive revenue. So we should be able to fully fund our public schools and fully fund housing and transit. So that's where I would start. It starts with EBF. In terms of my capacity as a state legislator, there's probably discussions that should be had around what the pension solvency looks like for our school systems. That's something that we're also actively looking into. And there are a number of bills that have been floated in recent weeks to try to sort of accomplish that.
One question about the federal budget bill. Given the changes that are happening to social programs, like how can Illinois respond, and is there any plan to have a state-run marketplace in Illinois in terms of healthcare?
Yeah. I mean, we don't have a choice. We have to do this, and I think some of the ideas that we talked about earlier are certainly ground zero for that. But I want all of our constituents who have ideas to reach out to my office. There's no idea that's a bad idea until it's been researched. So we have a good team that is whip smart. We sit down, we read the briefs, we talk to the agency heads to try to advocate for the public house, and people who are directly impacted, people who have the lived experiences, who I think are the people that are closest to pain and often experts on these issues. So we're going to be talking with them a lot in the months ahead. And in terms of the state-run exchanges, yeah, I mean, the ACA exchanges probably fit the bill there. There was legislation that was passed last year that I was the chief co-sponsor of that does puts us in the path of creating the insurance exchanges. I don't have the details on that, but we can report back out on those. I'll look back into it. Yes.
I have a lot of questions.
It's okay.
I don't know if you can answer this question. With everything that's going on in DC, you know, Trump claims that he plans to implement the same type of takeover in Chicago in October. So, as our senator, what communication is there that you know of between the mayor and the police department, or the governor and the National Guard? Is the Illinois National Guard or our police department going to comply with Trump's orders to take over our streets?
I would, yeah. No, we're not going to let the Trump administration just come in and flood our street with tanks. I can't see that happening. Not as long as I'm your state senator. I would hope that the people that steward our state right now would stand down any Trump administration making good on bringing in the National Guard. I have a couple friends that live in DC that sent me some pictures last night of what it looks like to see tanks in the street of DC. It's real, like it's real. It really is like something we have not seen in our lifetime. And all I can say is I will walk through the fire to protect our rights to exist. Because I know what it's like as the son of an Ethiopian asylum seeker who fled a war-torn country where my uncle was disappeared at the age of 24. I know what it's like on my mom's side as a black American woman whose brother was killed by state police when he was in his mid-30s. Like, I know what that leads to. And so we can't be complacent when the Trump administration is making these kind of threats. I know it's stressful and it's really anxiety-inducing to see the endless barrage of what they're putting out right now, but that's why you have people like me in power and those that are stewards of our state to fight back on that. And so I can tell you that my lived experience shows me deep in my bones what that means, similar to the Smithsonian purges, and that doesn't end well for anybody that looks like me. And if I'm a target, everyone in here eventually is a target. So we absolutely must resist. No National Guard in Chicago. And we'll do our homework too. I'm glad you asked the question because we'll follow up with the state police and with the Chicago Police Department and say, hey, what are we thinking here? Like, what's the plan? I don't want to find out the day after that there was a tank on 79th Street. Like, we're not going to let it get to that point.
I apologize for sitting
Yeah.
All media, because flat taxes, basically level the playing field. And it makes it certain, especially to small business owners, that I don't have to compete irregularly with somebody else who's in a national program, like ABC or something
Yeah.
like that. But I'm just saying that a flat tax on advertising, period, no more than 3%, and not to get it blunderly out of commission.
I got you, yeah.
But just have a flat tax on meat.
Yeah, well, I would want to look into that a little bit. I think it's an idea that we should study. What I would say though is that when we have this discussion in the spring around the digital ad tax, what I kept saying is that, you know, Facebook and Amazon should pay their share. You know, they are the big corporations right now that have taken over our entire world. I mean, it's just they've redefined how we relate to each other. They have been complicit in a mental health crisis that has affected young people in a way that even my generation as a millennial didn't have to experience. And so I want them to have some more skin in the game and some more accountability for paying for mental health programs and paying for transit and some of these other things. But your idea is, if I'm hearing you correctly, is to extend that to all advertising. Yeah.
Excuse me for cutting you, but everything, so that you have the capital to do exactly what you want to do.
Yeah.
And if I'm hearing you correctly, if we were not dependent on government, then this issue out of Washington and Russia relatively wouldn't be a problem. We would be, Chicago was built for war. We are under attack. These people are trying to hurt us now. So we need to respond in time.
Yeah.
If we don't, then this country is over. And I'm not giving a country up to a fascist organization that when I was 4 years old, I got to see a woman from Auschwitz in our community on the west side. And she was a former internee and had her number tattooed on her arm. No 4-year-old should see that.
Yeah.
And I did. But this woman said, never again. And here we are, some 60 years later. And I'm just saying that the Trump administration is not worth that. So, in and of itself, thank you very much for your efforts. But I'm saying a flat tax would put everybody on an even keel. And you would see things stop relatively. They would not attack. They would more or less come to you and say, Senator Simmons, what can we do to better look like we understand your community?
Yeah.
Rather than just openly attack.
I got you, yeah, we should look into that a little more, there could be a lot more there, yeah. And let's keep connected on the idea too, because I wanna look more closely at that.
Thank you.
Yeah, we should go on this side of the room, yeah.
Okay, my question's a little policy wonky, so stay with me.
That's okay, we like our policy wonks.
So before 2014, Medicaid was just for pregnant women, people with children, people with disabilities. So that kind of Medicaid is like 50-50, like states pay 50%, federal government pays 50%. But then the ACA came along and the federal government wanted to like incentivize states to do that, so the reimbursement rate is like 90%. So like Illinois pays 10%, federal government pays 90%. And the Trump administration came in and they're like, that's ridiculous, we shouldn't have to pay 90%. And so they were talking about lowering it. And luckily, that didn't happen. Yes, because if that happened, Illinois has a trigger law that if reimbursement goes below 90%, we will stop covering Medicaid for people without children. So that would have been a loss of 800,000 people in Illinois that would have lost Medicaid coverage. So my question is, was there a conversation in Springfield about lowering that? You know, if the federal government went to like 75%, we would go to 75%, or just getting rid of that trigger law altogether?
Yeah, that was a conversation, a policy discussion that I tried to initiate and a handful of progressives. I don't think they got very far. But we will continue to fight for this 800,000 adults in Illinois who have health care now that wouldn't have had it 20 years ago. They wouldn't have had health care 10 years ago. You know, my mother, when she was alive, right, there was a point where I was an adult where she wouldn't have been able to have health care. And there are 800,000 people like that in our state. So we'll continue to raise that because the trigger law always struck me as a disingenuous provision. And unfortunately, just the right person is in charge of the federal government to make a nightmare reality, which is that if, you know, Illinois falls right below that threshold that you mentioned, all of a sudden 800,000 people are without Medicaid or ACA coverage, and the state has to figure out how to come up with, what was the dollar amount, with $800 million to cover those folks? Yeah, that, and all the numbers that we've been throwing around tonight, that's, you can see that's not a good situation to be in. Yeah.
Okay, I also have, similar, well, not similar, but on the, SNAP and Medicaid, the community engagement provision of like work, school, community engagement. Okay, I know that the work requirement is like designed to, you know, hurt people and like be punitive. And I know, I work in federal regulations, I know the federal government loves to like say, give a vague requirement, not tell you, you know, make you figure out how to interpret it, then like get mad at you for not interpreting it the way that they secretly wanted or not so secretly.
Yep.
My question is, or it's like kind of a like 1.5 questions. How do you think, you know, this is going to be interpreted? Like, is it going to be community engagement? Like, it has to be like a official, you know, like legal organization? Could it be like a large scale, you know, like knitting or a reading group? Could it even be going to like the Edgewater Musical Festival? You know, that's like a community. You know, could it? And then is the half question is, you mentioned like with the changes in eligibility for refugees that like Illinois is going to do this, like even though the federal government is like trying to get these people off, Illinois is going to keep covering. Is there, do you think, you know, there's room for Illinois to have their interpretation that would probably be much like kinder than the federal government for as long as possible? I guess, what do you
Yeah.
envision community engagement will mean?
Yeah.
Like, what could people get approved as community engagement hours?
Yeah.
What
So
do you know?
it's a good question. We don't have the guidance quite yet on that. You know, so yeah, I mean, I would think that there will be advocacy organizations like, you know, the ACLU might, I feel like they would probably be a stakeholder that would come to the table if we have to implement the community engagement requirements as part of the work requirement on Medicaid. The goal should be to make them as humane as possible. My thing, the only thing I don't want is us to put people in a hamster wheel where we're telling them to go on the fool's errand and say, oh, you're 57. By the way, our district has a lot of people. When you talk about working families, there are a lot of households where there's one person in our district. Places like Uptown and Rogers Park and Edgewater, there are a lot of households where there's one person. I was one of them for 10 years before I met the love of my life. Right now, it's, you know, 2 of us in the same household. But that's a big demographic in our district. Those are people who are going to be affected if they're lower income. So I don't want them all of a sudden not be able to go get health care coverage, especially if you're 55 and 64. That's not a time you want to be playing around with chronic conditions. Like, I don't want them to be told, well, you have to go find a job, and then the person says, well, I've tried to find a job, I can't get upskilled, I don't know how to do this, that, or the other, and I can't find work, and there's no job training program to work. That's fallacious. Like, it's diabolical, in fact. It's so dishonest. So I think you'll see advocacy organizations like ACLU, Shriver Center, offices like mine will work together to try to implement this in a way that does the least amount of harm. You know, if somebody has to go to the Edgewater Music Festival to comply with this requirement, okay, maybe we can live with that. I still think it's not a smart thing to do, but that's the best outcome probably there. And so we'll work, once we get more guidance from the federal government, we'll work together to make sure that this is not just sending people into a black hole. Yes?
Thank you for doing this. I have a question about the legislation dealing with the clean needles and the injectable medication.
Sure.
What prompted that? What is being clarified, or what was clarified, and what's the backstory on that?
Yeah.
Because injectables that I've used come with the needle already. It's all preloaded.
Yeah.
And so, could you please,
Yeah.
what's the backstory?
Yeah, so this was a issue that was brought to my, and Representative Cassidy represents the northern half of our Senate district, Rogers Park, Edgewater. So constituents that come to us and brought this up as an issue. And, we typically support legislation that makes it easier for people who need access to health equity to be able to get it. We did something similar with PrEP legislation a couple of years ago where we make it easier for people to access PrEP through a pharmacy with a standing order. So in this instance, we want to make it easier for people to access those, things they need to be able to deal with whatever it is that prompted them to need to use the needle. There are some people in our communities that, having access to this could be life-saving for them. And so they may not have immediate access to healthcare or know how to understand how to navigate it. And so we want them to have access to that at the community level. That's more or less why the backstory. Did I leave anything out, Heather? Yeah, that's more or less it. It came from a constituent, like a lot of our bills do. Do we have any more online questions? We're going to go for another few minutes, and then I will be around to talk to folks about one-on-one as well. Is that it? Okay, so we'll get through the rest of the questions here, and then we'll wrap up by 7:30, I promise. Yes.
Thank you, and thanks to yourself as well as your staff for holding this town hall. Great to be able to engage. I have a question regarding the bill that was signed regarding the police and firefighter pension, the increase that obviously has a negative impact on the finances for Chicago. Can you elaborate a little bit more on some of the impacts we could see here in Chicago and to our budget? You mentioned a lot of things at the state level to help get more revenue. I don't know if there's any way some of that could be used to help offset these increased pension obligations that have been forced onto the city.
Yeah, that's an excellent question. And I would say that in the spring session, one of the things that we try to do is, so Senator Rob Martwick represents the district, 2 districts west of here, Jefferson Park. He chairs the pension committee. And so he was trying to build support for basically moving towards pension solvency, particularly for what are known as Tier 2 state employees who get smaller pension benefits than those that were working before the year 2010. That legislation is in the works. The police and fire legislation that you're mentioning right now, I don't have the exact details on that, so what I would like to do is to look at the bill and get back to you. And so let's exchange, let me get your info after the town hall, we'll get you an update on that. Yeah.
I echo the thanks to you and your staff. The fact sheet is great and this info. I have a question for bills under further consideration. SB 2462, which isn't listed, the Illinois Human Rights Advocacy Protection Act, which would repeal the 2015 anti-BDS law in Illinois that prevents Illinois pension funds from divesting from Israel. Will you be becoming a co-sponsor on 2462?
Yeah, I would like to look at that particular piece of legislation. What I have said is I think if we're talking about the same bill, the law that Browner put in place in 2015 should not be the law of the state of Illinois. So I don't support the state of Illinois penalizing a small business that has decided to boycott any country that they feel has committed or is indirectly implicated in human rights issues. So I've talked to a number of organizers that share that goal, and I think what really needs to be done is I think there needs to be a stronger push across the entire state government. I think that the governor's office needs to get engaged with this, as well as the House and the Senate. So we'll look at that particular piece of legislation and get back to you, but as a general rule, I think that the state of Illinois should not be penalizing, singling out any particular business for acting out on its values, particularly if there's human rights issues implicated. Yeah.
Yeah, so I want to bring back to kind of the cost of living, corporations paying their fair share. I think all of us have seen increases in energy costs. My bills month over month, year over year, have gone up by 50%. Wanted to know what we're seeing or doing not only for supply in the state, but to address the outside demand that corporations, AI, data centers, et cetera, are causing on our grid, causing us to pay more money, and essentially subsidizing their profits.
Yeah. You're absolutely right. We are absolutely subsidizing profits. So right now there's a huge upward pressure on the demand of energy in our state, and it's not you and me turning on lights in our apartments or using AC. It is the big data centers. And some of them are job creators, right? I tip my hat to them, but the amount of energy that it takes to power a lot of the data centers is creating more demand on energy, which, basic economics, if the supply is not there, all of our bills are going to be going up, and in fact already are going up. And so this spring, there was an effort that I supported to try to bring down the cost of energy that was not able to be taken up for a vote by the end of the spring session, but I would bet that we probably will be looking at it in the veto session or probably early next year. Senator Bill Cunningham is the sponsor on that legislation. Again, I'm supportive of the legislation, but as I said, it was not able to get to a final vote. I don't think it was on the substance. I think we ran out of time, honestly, at the end of the session. But that's an issue that's the top of mind for me and several of our Democratic state lawmakers right now. Yeah, there's some good articles too on this that I want to send you that you sound like you're already up to speed on it, but we'll get some stuff in our newsletters for folks that want to know more about the broader ecosystem of energy demand and supply. All right, we'll take a few more questions and then, are we all done? All good? Oh, I'm sorry, yes.
On the housing issue, affordable housing, I know there's been an increase in venture capital firms buying up residential rental properties.
Yep.
They're jacking up the rents and they have all these rules, it's been really easy to evict people. Would you be in favor of prohibiting venture capital firms from owning residential rental properties?
Yes. Yes. I would. And here's why. So in the 4.5 years I've been in the state Senate, I've passed a number of bills that would, for example, we have a bill that creates a cooperative housing fund to build more cooperative housing so people can live in community and be co-equal partners in their buildings. We have some wonderful co-op buildings in our community. There's one right just a block from here on Clarendon. There's several in Rogers Park, and so I think that's the direction we need to be going with our housing supply. The people over parking legislation, that's a part of the transit bill, that was my bill. Makes it easier for people to build new housing supply and not have parking requirements. I don't think that private equity and venture capital should be getting in the housing business. I want to be crystal clear on that. Because what happens is it's not about housing as a human right. It's about what's the bottom line profit goal for our shareholders. And that, I don't think that ends well for communities like Uptown and Rogers Park. I don't. And we already are caught with those in communities like ours. These are some of the most diverse communities in the country. It's hard to have communities like Uptown and Rogers Park. This is not the norm. And anybody that grew up here knows that. So I think we ought to maintain it. And I think that means making sure that everyone can live here at all price points. And I don't trust that private equity firms share that goal. And so I think that we should be leaning on our federal members of Congress and U.S. Senate to bring forth bills like this, because honestly, I'm not seeing it. I'm not. I've looked. Like, I watch what the federal representatives for our area, the kind of bills they're introducing. I have not seen anti-price gouging legislation. It may exist, I may have not seen it, but they ought to talk about it. Because our communities are the ones that are swallowed alive by private equity. There's buying up buildings by the dozens. I mean, in Rogers Park, we're seeing corporate landlords come in, buy up buildings, and people's rents are going up 400% in 1 year. And they come talk to us at street fairs and say, hey, Senator, we want to stay in Rogers Park, we want to stay in Uptown. And our office, by the way, bends over backwards to help people stay in our community so they don't get displaced and end up way north, way south, and way west. Because we think people should be able to live here if they want to. But, we need more people to throw their weight around with this issue, honestly. Okay, I don't want to keep you past 7:30. I'm going to stay here until 8 or as long as you keep me. I think we got everybody's questions, so no one's feels left out. Thank you so much for coming, everybody. I appreciate you. Make sure you grab our stuff on the way out. We have bags for you, and we're on social media at Send Mike Simmons on Instagram. Please follow us. Thank you.
Okay, one other thing too. We ran out of the handouts that have like legislative rundown, so if you didn't get one, for everybody who registered online to the event, we're gonna send out an email that has a PDF of that handout. We are also recorded this event, so we're gonna upload that, and we'll send that out as well.